This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
Good morning, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. Indeed, I am. Another beautiful day in the neighborhood. Make sure you get out and enjoy it. And we're going to talk a little about getting out and enjoying things and a little bit of exercise and the things that you're going to need to do to maintain a very significant platform, particularly in one area that we're going to talk a little bit about today. As a matter of fact, we're going to talk a lot about that. And, what am I kind of alluding to? Well, I've had the opportunity for the last 3 days to sit and listen to some of the most brilliant people in functional human nutrition and biochemical applications in the country, and maybe in the world. And 24 hours, I'm kind of brain dead, but I'm going to bring you as much data and synthesis as I possibly can. Those of you who read my social media platforms over the last 24 hours or so know that I'm going to talk about, what are we going to talk about? Dementia, Alzheimer's disease, adult onset, all those things that scare the hell out of us. And, because as we get older, and matter of fact, sometimes not, it doesn't take age to make it happen, we begin to see signs of our brain not working the way it's supposed to, misfiring, if you will, not having the acuity, the recall, the capacity that we had when we were very, very young. And there's some overlaps in a lot of different areas, and I want to set the platform straight for you. But here's the deal. The rate of Alzheimer's, the increase in dementia over a period of time has increased exponentially. Just in the United States, just this old country, US of A, we have something close to approaching 6 million cases of Alzheimer's on an annual basis. That is unbelievable. And so when we're talking about the inability to cognitively do what you want to do, to be able to function and care for yourself, and ultimately the breakdown of everything else that goes with it, this is significant. And guess what's happening? It's rising. It's not something that is going away or getting less of, and we really need to understand it, and we need to understand what is taking place and why we have the problem that we're having. Dementia by itself, we use it that way, is a group of symptoms that together affect your capacity to process normal thinking, reasoning, to be able to communicate properly, remember things, the reasoning ability of a human being, what's normal. All the symptoms make it difficult to perform what we call activities of daily living, or just simple daily tasks. Just something as simple as like eating. Sometimes we forget to eat. And we said, how did that go? Or we walk into the room and we forget why we were there. Something mild like that. Or, years ago, I think it was the first time I saw it, you saw the commercial on television where somebody opened up the refrigerator, they went in to get something, and they forgot their keys inside the refrigerator. Not so good when that takes place, particularly if you're doing it on a regular basis, not so much in the refrigerator, but in other different places as well. But the incidence, of dementia is dramatically increasing. And when we understand that, and we understand that it gets worse as we get older, that 5 to 8% of the people over age 60 to 65 years old have some form of dementia. And it doubles every 5 years over age 65. That's scary, isn't it? So we have to know what's consistent with people, what's really taking place, why we're having these, this increase, if you will, in symptomological processing presentations. So, if we have memory loss, and it's generally noticed when, you're looking at someone that is close to us. We know how they function and we see it. We can see these cognitive and sensory changes. We see people searching for words, difficult in communication. You can't find the right word to apply. And sometimes it's very mild, but it happens. And we say, oh my God, well, I'm getting older. I never used to do that. The reduced ability, if you will, to organize and stay focused and plan and resolve problems and things of that nature. What happens is sometimes we get disoriented. It's like, what was that all about? And you lose track. It's like, you're suffering now from ADD, ADHD, where you didn't have any of those problems years ago. The, motor function begins to dissipate a little bit. You find that you don't have the tactile dexterity that you used to. Even reduced visual perception and loss of taste and decrease of smell. All of those can be symptoms that are on the onset of dementia. You have physiological changes too, that as things get worse, over a period of time, and it doesn't have to be Alzheimer's, it can be other dementia patterns as well, but changes in your behavior patterns, your personality. Somebody will look at you and say, "You never like that. You were never so sharp and biting and kind of setting things aside. Depression, you're kind of down all the time. You're anxious. You're not sleeping at night the way you're supposed to. You start seeing or hearing things, hallucinations, either auditory or even visual hallucinations. All of a sudden you see something pass by you. Your moods are like a pendulum. They swing from one side to the other. You're agitated. And then sometimes you get in a state where you're just apathetic. I don't care. Whatever. Go do what you want to do. Well, it's going to cost you. Well, so what? Doesn't make any difference. All of those things are beginning telltale signs of dementia patterns. But you know what? At the end of the day, there are things that you can do to make a difference. Now, there's a differentiation between dementia and Alzheimer's, and there are many different types of dementia. We can have just brain fatigue dementia. We can have nutritional dementia. We can have trauma-induced dementia. But at the end of the day, if they last too long, they can break down the same genetic patterns that ultimately produce Alzheimer's disease. But it also has to do with the location within the brain and what happens and so forth. People get forgetful, amnesia, if you will. Amnesia can be a fully what they call characterized by a mental disorder, and it's a loss of memory, of I don't remember. I don't remember any of those things. How can you remember that? I have some friends who can't remember how to get to their high school that they grew up in because they've been away for so many years, and you put them in that same area. Yeah, it's changed a little bit, but they still can't figure out how to get there. So you have to look at the patterns and the prevalence across the pattern. The worldwide estimate of people with just dementia, according to the World Health Organization, is something, and this goes back about 3 years ago, is something in the neighborhood of about 60 million people. And, this is projected to reach something in the neighborhood of, there's a skew. They're saying somewhere between 85 to 90 million people by the time we get into, close up to 2030. And they say as time even advances by that, we're looking at 170 to 175 million people from 20 up to 2050. Now, that's not okay. And then they're saying that this comes from low and middle income countries. Well, take a look around us in the good old United States. We're seeing more and more of that. But as I said, within the United States, we're talking about somewhere between up to 6 million people are living with dementia. mostly Alzheimer patterns. And so the prevalence of this condition is exponential. So what I want to do today is I want to give you as much data, and I want to take your questions. The medications that they're using to control these things in most cases don't really have a major impact. So if that's the case, why are we using them in the first place? That's always the question, particularly where I come from. Why would you use something that really doesn't work very, very well? I don't know, but we're going to discuss that. Remember, you can reach me today. We are live at 888-630-9625. That's 888-630-9625. Love to take your questions on this or anything else. And by the way, when I'm not here, all you need to do to get a hold of me is go to rosellecare.com. That's ROSELLECARE.com, rosellecare.com. And send me a note. I'll get back to you. Or if you need to talk to somebody quickly, just go to Roselle Care, call the office, or the number there is 703-698-7117, and tell them that you got to talk to somebody and you want to talk to them pretty quickly. There was a doctor that I listened to over the weekend, and this weekend, I guess we're still in the weekend, but my days and nights are being mixed up simply because I'm in the midst of all this craziness. And his name is Dr. Wayne Soldano, and brilliant doctor in functional human nutrition. And he was talking about what happens in any kind of dementia, any kind of memory loss patterns. Doesn't make any difference whether it's Alzheimer's, whether it's drug-induced, and so forth. But he was bringing out what's called epigenetic SNPs. And remember what we've talked about, what epigenetics is that the impact of your environment, your biochemical environment, means your foods and your exposures and your electromagnetic fields and so forth, your mental environment, how you think, how you react, the decisions that you make, the meaning that you give to things, and then the structural neurological environment, the impact that you have there. Are you living with pain on an ongoing basis? Is your body succumbing to the insults of, different situations on an ongoing basis? And what I mean by different situations, are you, too out of shape? You have no core. Your body's hurting. You're in pain all the time. You're putting up with. You're taking things to deal with that. So when we talk about epigenetics, we're talking about your genetic map, your DNA, right? That which you came into the world with. And then we're talking about the RNA-based expression of that DNA. RNA is, by the way, for those of you who want to know, and most of you know anyway, but it's ribonucleic acid. And there's something called mRNA, which is messenger RNA. What that is, when you hear that term mRNA, you're going to hear a lot about that, by the way, with all the vaccines that are being developed for COVID-19 and the like. It's basically the conductor. It's the orchestrator. It tells your DNA what to do. It's the guy in the cell that allows that cell to express itself the way it's supposed to. So when we're talking about DNA methylation, and you're going to hear that terminology as we go through this, the development of all these things, it's basically, if you put another term, it's called gene silencing. So it's going to silence some of the good guys, but it also may silence some of the bad guys. And you want them to silence the bad guys, and you want to express the good guys to protect you, right? So we have to make sure that we talk about those, and that's what we're going to talk about today. It's really important that we get that. But we're talking about dementia. We're talking about Alzheimer's. Call me at 703-69. Oh, no, you can't. You got 888-6. Anyway, call me in a minute. I'll be right back. Don't go away. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. Indeed, we are, and just for you, as we do every Sunday at 11 a.m. on the Eastern Seaboard. We're talking about dementia and the ability to not say, oh, my God, where's my head, and what did I walk into this room for? And unfortunately, many of us are getting the onslaught of our environmental impact that is causing what we call neurodegenerative process or condition. There's adult onset or old age dementia, and there is Alzheimer's, and there's a lot of things in between. And we're trying to distinguish between them. And by the way, I wanted to give you the phone number here at the studio again. It's simple, 888-630-9625. I'd love to take your phone calls today on this or any subject. We're talking about how our brain works. And I was telling Jeff offline, our engineer, that, you know, after 24 hours of listening to lectures and several conference calls over the last 3 days since Friday, my head may be reflecting a little bit of what I'm talking about, but not necessarily. We'll make sure that we get you all the data. But we're going to talk about this ongoing process and, you know, mild cognitive impairment. And if you go into the literature, you're going to hear things like mini cognition and many mental, problems, and it goes on, and cognitive impairment. There's a lot of buzzwords out there. But here's the deal. In our society, because of our lifestyle, because of the things that we're exposed to, because of so many things that are ignored, inoculations that are put into our body, vaccines, I'm sorry to say, are increasing our risk and expression of dementia. So, we're coming up to in now in the flu season. You've heard it all over the place, right? Make sure you get your flu shot. If you don't get your flu shot, you have a greater risk for getting COVID-19. Actually, it's reverse. If you get a flu shot, your risk of getting COVID-19 actually increases. And there's data that supports that across the board. We were talking about it this weekend with a group of several hundred doctors. And you need to really understand what the risk-reward ratio is for this. And that's an area that we'll get into if you go to my Facebook page, at Tom Roselle on Facebook and our Twitter account and so forth. I'll be posting things about that as we go through. So these mild cognitive impairments, if they're not stabilized and treated properly, will move on to more significant dementia states. There's a question that was asked over the last couple of days by one of the doctors and said, what is the estimate of somebody living with advanced dementia? How much, once they get to that place, not Alzheimer's, but when they get into dementia, how long can they live? And the average is like 5 to 6 years. So it dramatically increases your longevity, in the world. So you have to look at the risk factors. So what are our risk factors? As a society, do we have certain things that we can point to? Well, the answer is yes. And one is when your cholesterol level starts increasing, your blood pressure goes up, and your diabetes pattern begins to be marginal. What do I mean by that? I mean, you're starting to see increases in blood sugar levels. Your A1C starts rising. And there's another term for that, and you've heard me talk about it before, and it's called metabolic syndrome. So as we start seeing metabolic rises and changes and shifts, blood pressure going up, blood sugars changing, blood fats starting to change, those are warning signs. Those are keynotes. And then depression. And then, by the way, if we're isolated, like we have been for the last 10 months, when you're isolated, that increases your risk of cognitive inactivity and interaction. And subsequently, when you're not training your brain begins to break down, and you don't have the ability to recall. You don't have the ability to be as sharp as you used to. And you're sitting there in front of the tubes, and you're listening to the talking heads, and you're being stressed out, and your anxiety levels goes right through the ceiling. So we're talking about the burden of this disease affecting something in the neighborhood of up to 100 million people globally. That's 100 million people. That's crazy, right? So also, you have to look at how you're a smoker. Have you ever been a heavy smoker? That also increases your risk of doing that. What's your sweet tooth like? If you're eating a lot of sweets, your risk of dementia is going to go up. Period. End of stories. And those of you who are carbohydrate junkies, your risk of dementia goes up. So take a look at your environment. Take a look at your blood sugar levels. Now, when we run blood chemistries on people, and we see low levels of vitamin D, not only is your immunological system being triggered in the wrong direction, and if your zinc levels are low, also your immune system is being triggered in the wrong direction, but it also are targets that indicates that you're going to have an increased risk of developing dementia problems. Now, in the second half of the program, we're going to get into some of the things that you need to do and you need to watch for and what we can do to fix. We're here at 888-630-9625. Give me a call. Love to talk to you. Don't go away now. We'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM, WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live in this absolutely gorgeous, gorgeous Washington metropolitan environment today. Make sure you get outside and have some fun and go for a walk, go play some ball in a park someplace. Just get out and enjoy it. You need to reduce the anxiety level and really, truly relax. Talking about a very interesting subject, one that many of us are fearful that could be our outcome. But you know what? At the end of the day, if we do what we need to do, it won't be. What am I talking about? We're talking about dementia. We're talking about Alzheimer's. We're talking about all those things that can trigger it. You know, dementia is a disease with major impact on the patient themselves, the people around them, families, and so forth. It's crazy that it is in such an meteoric rise, if you will. We're talking about millions of people, and we're talking about huge numbers by the time the next decade rolls by. So what can you do about it? What can you do to fix it, and what can you make sure that you're not in that situation? The United States suffers more desperately when it comes to dementia patterns than any place else on the planet. Seems that we have that, that ability to be the number one in so many things, even supposedly this stupid COVID virus that's out there. Well, as time goes on, you're going to find out that the United States, even though that we spend about twice as much as any other country relative to healthcare, that in fact we are one of the sickest when it comes to the wellness quotient. And that's not okay. That's not a good thing. But, we hear more about Alzheimer's. Everybody's afraid of Alzheimer's. You see the commercial on television. Well, there are many different pathways that occur before Alzheimer's. So, is there a checklist? Are there things that you can look at that, your risk level might be more so than anybody else? Well, perhaps. Take a look at your diet, number one. If you're not eating somewhere in the neighborhood of a paleo-Mediterranean type of diet, and your diet is heavy with processed grains and tons of sugars and things of that nature, your risk level just went up. If on blood testing, if your vitamin D level is low, your zinc levels are low, your blood sugar levels are starting to rise, your fat levels, your lipid levels are starting to increase. And particularly, there's a ratio. I'm not too concerned about what the drug companies tell you want to have as far as normal lipid levels, because those were designed to put you on statins. But what I am concerned about is the ratios between them and what they really mean. If you're taking a statin, by the way, and your blood fats are too low, your risk of dementia and cancer and other hormone-initiated patterns increase dramatically. And so when you start seeing lipid levels down under 170, that's a flag that says, we got a problem. Now, some of you have a genetic piece that keeps them that low, but here's the situation. You have to make sure that you keep them in a balance because your brain needs fat, your hormones need fat, your neurological transmission in your body needs fat. You need fat to heal with. And if we drop it too low, none of those things are possible. And you end up with a greater risk of all kinds of things, but particularly what we're talking about with this type of situation. If your intestinal bacteria, your good guys, your microbiome is all upset and you have critters living in there, viral patterns and fungus and pathogens that shouldn't be there, your risk level just went up. If your body's under a continual amount of stress, or you're sleep deprived, you don't sleep at nighttime, or you sleep too little, even if you're going to bed and falling asleep, your risk level just went up. So what we're talking about are what's called non-genomic or non-DNA expressed risk of these types of conditions. And we have to make sure that we're aware of things that we can change. And the good news is that you can change this stuff. I was listening to a presentation by somebody who I have a tremendous amount of respect for, and he was talking about the impact of vitamin B12 and folate on neurological transmission, but also on mental acuity and mental capacity. So a lot of us are running out. We're taking B12, but we're taking cyanocobalamin. Now, cyanocobalamin is the cheap form, and it's the one that supposedly, if everything is working the way it's supposed to, it's like the trunk of a tree. And off the trunk, there are going to be other branches, and that's your methyl forms. And then off of that, there's small stems, and that's your hydroxy form. And then off of that, you have other little pieces, those are your tetraforms. Now, they all do different things in the body. But when it comes to dementia patterns, we're talking about methyl pathways, methylation conditions within the body. And that's, you're saying, what? What does that mean? Well, that means how we keep inflammatory levels under control. But we need B12. So here's a growing piece of evidence as well, why we're also seeing more and more patients with dementia and with Alzheimer potentials. There's something called an MTHFR failure, and it's almost about 50% of the U.S. population. What does that mean? It means that you don't have the ability to convert folic acid into the active form of folate. So folate is what the body uses. And where does it happen? It happens in the liver. So people are having liver function problems that are being now passed on generationally, but also the environment itself can cause things to shift. That's our epigenetic pattern. So take a look at your diet, my friends. Take a look at the stress levels. Take a look at the drugs and medications that you're taking. All of these things have an impact when it comes to the body's ability to have normal cognition. And if we don't do something about it, there's going to be more and more of us walking around not knowing our own names, and that's not a really good thing. And I'm not going to get into the genetic expressions of it. There's things called alleles, and that means that you can actually have a test done through our nutrition department or other medical facilities to see if this allele, and in the case we're talking about is an APOE allele, that if it's being expressed improperly, the allele itself shouldn't be recognized at a high level, increases your risk of dementia. So if you're hypertense, if you have any kind of blood sugar handling, if your blood sugar or your blood fats are out of control, if you are in a constant state of depression, if you're not stimulating, your intellectual capacity, you're sitting in front of the stupid tube all the time and not trying to increase who you are, then your risk level just went up. Now, you add that to, were you a smoker at one time? Do you have a lot of sweets in your diet? What's your fasting blood sugars? What do they do? Are they over the top? There's check marks that you can really put together to make sure that your risk level is where it's supposed to be. And the good news is that all of these things are modifiable. Somebody who lives in pain constantly, you have headaches all the time, or you have joint space pain, or, you have muscular pain, and you're living on drugs or medications, you just increase your risk of dementia. It goes up significantly based on those presentations and what you're willing to live with and not willing to live with. It's not okay. It's not a good thing. So you have to do something about it. You have to make sure that you take the opportunity of shifting those things that you can shift. And I'm going to talk about the number one thing that you can do to make the biggest impact. The number one thing, and there's one thing above all else, if you didn't do anything else and you did this, and there's probably a second one there too, but we're going to talk about that, and we'll talk about as the show goes on. But we're here at 888-630-9625. That's 888-630-9625. Give me a call. Love to talk to you about any concerns that you may have on this subject, or anything else that has to do with your health. So we're talking about the pathogenesis, if you will, of this craziness of losing our minds, the forgetfulness as we seem to get older and say, well, what do you expect for your age? I'll tell you what I expect from my age. I expect to continue to increase my capacity to be able to assimilate data and information. Now, we've talked about the fact that I've had a few bumps and blows to my noggin, and there was a time after this last one that I had. We talked about the blow that I took in May, bouncing off the floor, and a concussive pattern that was quite significant, that I spent about 30 days wondering if I was going to get my marbles back. And fortunately, because I know how to do the things I need to do, and I've had the right amount of care, I've had neurological patterning done, I've had acupuncture, low energy light laser, nutrition has been over the top, supplementation has been significant. My head is coming back sharper than it's been in the past. And well, maybe I had a little problem before that and I didn't know it, but nevertheless, some of you say, yeah, he does. Well, we'll save those commentaries for later in private. No, nevertheless, seriously, if you do the things that you should be doing, you can turn this around. So what's the number one thing that you could do that if you're not doing it, you dramatically increase your risk of dementia? The number one thing, think about it. Many of you like to sit around and read, that's your sport, right? Or you wash dishes and you do housekeeping and you do whatever you're going to do. Or you go to the desk, you sit in front of your computer. In the world of COVID, right, you've been locked down for months and you haven't gone outside. Fortunately, many of you have said enough's enough already and you're getting outside, you're doing the things that you need to do. But what's the number one thing that if you change it, you can dramatically, significantly shift the epigenetic pattern when it comes to dementia, Alzheimer's disease? Any guess? Anybody know? It's called exercise. How many of you get exercise on a regular basis? How many of you park your car way away, walk the stairs at work, go up and down, get outside and get some exercise? How many of you do a little weight-resistant exercise? All of those things are important, significant, critical, if you will, in putting aside the tendency to develop dementia patterns, but more importantly, they can change them as well. You can change your ability to remember. The more exercise you get on a day-to-day basis, routine exercise, not weekend warrior stuff where you're going to get hurt, but day-to-day exercise. Get out and walk a half hour, do a little stretching, do a little gentle core exercising. That all by itself will significantly shift your mental acuity drastically. If you go in and you do the literature research, you're going to find that people who exercise on a regular basis and continue exercise do well. What's the number two situation? You've got to watch your diet, my friends, and get rid of the sugars and the sweets in your body, particularly one called fructose. If you're a soda drinker, look on the side. If you're eating too many fruits, fructose is in fruits. Yeah, fruits are good for you, but in small amounts. I tell people to get off of sugars. What do? They shift over to eating huge amounts of fruits and fruit juices. You can't do that. It's supposed to be just a little bit, a taste, if you will. A little bit. You're saying, yeah, I'm done. I'm not listening to this guy anymore. Well, I'm giving you the truth, and you do with the truth what you want to do with it. But if you do the data, look up fructose, and the worst of all of them is corn-derived fructose. If you see that on any package, don't pick it up. It's not good for you. It will cause mental degeneration. It will increase vascular plaquing. It will increase your risk of Parkinson's as well. Not only dementia, but that situation is a process of degeneration. So we have to make sure that we have the tools, and you do have the tools to fix this and so many other things. So we want to exercise. We want to get sleep. We want to eat well. Those are three things that every one of us have within our own grasp, that we can change virtually anything. Those of you who are sleeping, as I said earlier, but you're only sleeping like 5 hours a day, not okay. Not a good thing. One of the primary things that we notice with patients as they get older and they develop dementia patterns, or their mental acuity is not quite as sharp, is the decrease in melatonin in the body. Once you start hitting, your late 30s into your 40s, but particularly into the 50s, your melatonin starts dropping exponentially. And when it drops down, you can't go into normal restorative sleep or stay there long enough. I have patients that put on very heavy dosages of melatonin for a lot of different reasons, but that's one of the things that we notice that really goes down the tube. So low amounts of methyl form of B12 coupled with folate, not folic acid, making sure our diet is what it should be, making sure that we don't eat sweets on a day-to-day basis, get rid of the carbohydrates, but importantly, get out and exercise. Get off your tush, go for a walk, stretch a little bit, learn how to do some moderate, mild core types of exercise every day. But if you don't do it, your chances, your risk of dementia patterns increase significantly. If you were ever a smoker, you've increased your risk. So there's ways of detoxifying that. We come back, I'm going to give you a little bit of a synopsis, things that you can do to help yourself. You're listening to Dr. Tom Roselle Live. Don't go away. I'll be with you in a minute.
Washington's Mall, 105.9 FM, WMAL.
Welcome back, everybody. You're listening to Dr. Tom Roselle Live, just as you do every Sunday, 11 a.m. on the Eastern Seaboard, Mid-Atlantic area. Tell your friends about the program. Make sure that they have the same opportunity to learn as you do. And don't forget, if you need to talk to us when we're not here, simply go to 703-698-7117. That's the Roselle Center for Healing, or online at rosellecare.com, and send us a note. We'll get back to you and make sure that we answer all your questions. The last several days have been very neurologically impactful for me. My brain has been in overdrive listening to some brilliant doctors from across the country, several from outside the country, and we've been online conference for 24 to 25 hours, and then a couple conference calls after that discussing some things. But, we're talking about dementia. We're talking about how the mind begins to not function properly. It's not just forgetfulness, but it forgets how to do certain things. Ultimately, it could end in the place of forgetting how to eat, forgetting how to take care of yourself. And that's the progression as we begin to see, not only with Alzheimer's, but very advanced, severe age-related dementia. And it's not okay when we realize that it's exponentially increasing and that we're looking at, hundreds of millions of people worldwide by the time we get to 2030. This is a severe situation. We see it on much more subtle levels. Many of the experts out there think that this is understated relative to everything that we know about it. We've been seeing this exponentially in our practice for years now. And so what's the key here? We talked about diet. We talked about several nutrient situations and trauma, living with pain and things of that nature, and blood sugars going up. We know that if you're overweight and have too much fat on your body, you're going to be much more susceptible to all kinds of problems, and particularly inflammatory cascades. So here's the key. This inflammatory cascade that we talked about with COVID, there is a consistency in many different conditions, but particularly with dementia as well. Chronic inflammation is due to, in many cases, when there's no history of injury, chronic obesity, accumulation of excess fat. Now, there's something that we used to kind of kid about on stage in the presentation. It's called a skinny fat person. And what do I mean by that? Somebody who looks fairly good on the outside, but on the inside, they have a lot of accumulation of fat. And it's because their genetic map really doesn't allow them to express themselves with external fat. It accumulates around the organ systems, around the liver, around the heart, and so forth. That's just as bad, and it makes them much more predisposed. And what you're going to see with that is that their coronary C-reactive protein is going to start going up. That's a measure of inflammation. It's an inflammatory marker. Their homocysteine level, which is a indirect measure of B6 folate and B12, which is something that we all should have done on a regular basis when you have your blood work, but your docs don't do it, most of them. That is another indicator of inflammatory reactions within the body. So when we take a look at our diet, we're looking at ultra-processed foods. We're looking at things that we talked about, the fructose levels that can promote, what we call lipogenesis, or the accumulation of fat and fat cells. These things cause inflammatory reactions. How many of you are fast food, junk food experts? You grab as you can, you grab Mickey D's or whatever it is, instead of preparing foods, or at least going to food bars. And I don't like naming names, but going into Whole Foods, or going into, and finding a salad and putting some meats on it, or some chicken or some fish or some beef or something of that nature. And we're not even talking about organic foods at this point, but we need to get to the place where we're talking about organic. We want to find ways of supporting our body. Did you know that the more garbage that you eat, the less you have the ability to satisfy that desire, I'm hungry? It's crazy, right? But that's the truth. So if you start eating well, the first, month or two is going to be difficult, because you're going to still mentally, you're going to crave things. The first week, you're going to still biochemically crave things, but you're going to decrease that inflammatory response. And when inflammation goes down, your nervous system, your brain starts working the way it's supposed to. But you've got to do what first? You've got to exercise. You've got to walk. If nothing else, and you're home all day long, go up and down the stairs 20 times. And then do a little stretching, and get on the counter and push back and forth on the counter. Do something different, but get something in your life that is going to increase your metabolism. And then start looking at your shelves. Look in the refrigerator. Look in the cabinets. How much of that stuff, would you think would kill an ant? Well, it's going to kill you if you're not careful. We're here every Sunday bringing you the most important information to help you help yourselves. That's why we do it, and we do it for only one other reason, and the primary reason is simply this. I love you all. I'll see you next week. Take good care. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.